Welcome back. Let's continue to part 2 where I'll explain the benefits and risks of bariatric surgery. Let's start with the benefits. After having bariatric surgery, you'll need to make healthy lifestyle changes to lose weight and to keep the weight off after surgery. Most people see major improvements in their overall health, especially if they've had weight-related health conditions. One of the most common health improvements is lower blood pressure. Your doctor may bring down your blood pressure medication doses or even say you don't need to take them anymore. Having a normal blood pressure will lower your chance of having a heart attack, stroke, or heart failure. Another major benefit of bariatric surgery is that it improves or even resolves type 2 diabetes. Most people need to take less diabetes medication after the surgery. The improvement of diabetes will lower your chance of having damage to your heart, blood vessels, nerves, kidneys, and eyes. If you suffer from sleep apnea, your symptoms such as insomnia, daytime sleepiness, anxiety, irritability, and headaches may greatly improve after bariatric surgery. Your sleep apnea may even go away completely. Bariatric surgery is also shown to lower cholesterol. This means healthier arteries and a much lower chance of having heart disease and heart attack. Many people are able to take fewer cholesterol medications or even none at all. Losing weight after bariatric surgery places much less stress on your joints. You'll be able to move more easily. Also, you'll feel less strain while exercising, and joint pain will no longer be a roadblock to leading a more active life. There are many benefits of bariatric surgery. Besides lowering major health risks, almost all patients tell us that their overall quality of life greatly improves. But you don't have to take my word for it. Let's introduce you to some patients who have had bariatric surgery and want to share their stories with you.
I've struggled with my weight for about 20 years, and I just sort of felt like my ability to enjoy life and do the things I wanted to do was being minimized.
I didn't want to be in public, and I didn't want to go and do things, and I didn't want to put my face forward.
I didn't really have much of a life because I couldn't walk very far. A couple of blocks and I would be in pain, and every time I wanted to go somewhere was, can I get there and get back? I had a lot of issues. I had diabetes, high blood pressure, and I felt that if I didn't do this, I was shortening my life.
I tried my best. I went to the gym. I tried to eat healthy. Nothing seemed to work for me.
I no longer have diabetes. I no longer have high blood pressure. My cholesterol medication has been cut in half. I walk everywhere. I love walking. I still have arthritis because I've done in my joints over the years. That can't be reversed, but it's nowhere near what it was like before.
Just this Monday, I went to my sleep study doctor, and I got the results of my sleep study, and I put my sleep apnea machine in the basement because I don't ever need to use it again as long as I don't gain any weight.
Life is kind of easier in a way. It's much harder in other ways, but I can move around and do things, and I'm not afraid to go and do something.
Before my surgery, I was taking 3 blood pressure medications, and they weren't really doing the job. And I had high cholesterol, and the high blood pressure's gone. The cholesterol's gone.
The cholesterol and the gout, actually, within 3 months, I was off all my medication, and all my blood levels had returned to normal, which they'd never been.
I feel that I've regained a whole new life.
This isn't a quick fix. I think that it is a tool that can help people who are struggling with weight. I've used this tool now to achieve my goal. It's a lifelong goal, and it will continue throughout my life. And it's certainly not easy. And it's just it's a journey that I'm on, and it's hard, but it's good.
Now that you've heard about the many benefits of surgery, let's talk about some of the risks and complications or problems which can happen with both the Roux-en-Y and sleeve surgeries. Risk refers to something that can go wrong after the surgery. One of the more common risks after having bariatric surgery is developing an ulcer. An ulcer is an area where the protective lining in the stomach has eroded away and the layer underneath is sensitive to stomach acid, People may feel nausea and pain just below the ribs. Usually with medication, these ulcers will heal in a few months. Who is at risk for developing an ulcer? People who smoke, drink too much alcohol, or take ibuprofen or other anti-inflammatory medications. The chance of getting an ulcer doesn't decrease over time, so you'll have to quit smoking, avoid taking anti-inflammatory medications, and drink less alcohol for the rest of your life. Another possible risk of bariatric surgery is known as a stricture. A stricture happens when the passageway that connects the new stomach pouch to the small intestine becomes too narrow. This makes it difficult for food or water to pass through. People usually feel it's hard to swallow or get their food down. Sometimes they vomit. When this happens, a short procedure can be done to make the area wider. A gastric leak is another possible complication. It happens when stomach contents leak into the abdomen. This rare but serious complication happens most often within the first 2 weeks after surgery. If it does happen, you may have a fever and stomach pain. Sometimes you may need another operation to close the leak. Having bariatric surgery will change the way you need to eat and how you absorb your food. You could get vitamin and mineral deficiencies. To prevent serious complications such as weak bones, low iron, or vision loss, you will need to take supplements every day for the rest of your life. Losing a large amount of weight can cause loose skin. The amount of loose skin is different for everyone, and there's no way to know how much you may have. Unfortunately, exercise will not help reduce this. Some people don't see it as a big problem, but for others, it can be quite upsetting. You can have excess skin removed, but this procedure is not covered by OHIP. Having bariatric surgery can be quite stressful and may trigger some mental health difficulties, especially for people who have had similar challenges before, such as depression or anxiety. People who have bariatric surgery are also at risk of developing addictions. This includes both alcohol and other drugs. This is one of the reasons we recommend drinking less alcohol. Now that we've covered the most common benefits and risks of bariatric surgery, let's check in again with some patients who would like to share some of the challenges they have had to overcome.
I didn't have any complications during surgery at all. It went as textbook planned.
It's been a big success for me, but you have to know that there are complications for some people, and know what they are.
I had a major complication where I was bleeding internally. I had the surgery in the morning, and by midnight that evening, I was losing lots of blood, and my surgeon who performed the surgery was there. They clamped it, fixed it all up, but that was certainly an issue, and there's risks with everything.
First I had was the leak. My heart rose to extreme highness, so it was a very scary thing for my family.
10 minutes or whatever after whatever I ate or drank, I would throw it up. I had absolutely no pain. I just couldn't keep anything down. If I wouldn't have been throwing up, I wouldn't have known. They kept me overnight and they did a scope and they said they found an ulcer. I had a 3-month follow-up. Everything was fine. I didn't need any of the medication again, and I'm great.
I had difficulty with the diet, basically. So they opened the stricture, they opened up the tubes so that I could get more food down. It was wonderful. I could eat.
Well, remembering to do them and being faithful to doing the vitamin and mineral treatment post-op is, it's a constant, new habit to build, but it's a small price to pay for what you get.
It's very common right after the surgery to have some depression and buyer's remorse is one of the ways it's put. I felt a little bit of that, but I got over it fast. I think that's just part of the fact that you've just had major surgery.
I mean, for me, I lost my weight very quickly, and so there was this one day looking in the mirror and kind of going, oh my God, who am I? Like, it was such a shock. Like I sort of didn't really recognize myself and sort of had to reacquaint myself with this new body. And that took some adjusting.
Throughout the weight loss I mean, it appeared that there was going to be more loose skin and that type of thing just because of the drastic weight loss.
I try to hide it as much as I can, but that's going to be an issue because I'm still losing weight, and I know it'll be an issue, and I'll probably have to have some surgery to correct it.
I look okay with clothes on, and I don't take my clothes off in front of anybody who doesn't already love me to bits. So, you know, there you go.
Like everything, I think it goes through a phase where you kind of look at it like, okay, but I'm healthier and I'm happier, and you know, I'm able to do so much more.
The outcome today, looking back, was worth every complication. I would rather have gone through all the loss of blood and the scary times and the procedures and the ulcers to be where I am today.
As you can probably tell from those who have shared their stories, surgery was just one step in their weight loss journey. It is important to remember that every person's experience with surgery is unique. Together, we will need to consider your specific situation and review your benefits and risks. This is the end of part 2. Again, if you have any questions about the benefits and risks of bariatric surgery, make sure to write them down and ask the bariatric team.